everyone, this is Leah, Ashley, Julianne, and I'm Danny from SCSS.
So thank you everybody for commenting about things that you want us to kind of present to you in a video. Ashley George from Hearts and Hands, you requested feeding milestones, but since that is such a big topic to discuss, we could literally be talking about that all day. Today we decided to talk to you about feeding milestones in correlation with the motor milestones and how they go hand in hand. So if there's any specific feeding milestones you want us to touch on, please let us know. But today we have OT, Ashley, and Leah, and we're going to be talking about how motor milestones and feeding milestones go hand in hand. So Leah's going to talk about an evaluation we had today to give you kind of an example.
All right, so we go in to see a baby in the home, 9-month-old, adjusted age 5 months. And so we start the evaluation. Baby's really not taking anything by mouth, G-tube fed, trach vent dependent. And so one of our first questions when we get past the medical and significant history is, has this baby been seen by OT or PT? And luckily has recently been evaluated by physical therapy last week. And so our question when we go in is, what is their motor age comparable to?
And it was 3 months.
3 months. So we had one of our graduate students with us, so we were able to talk all this through. So we adjust the baby back to 5 months, which is where we would expect, where we're gonna base our skills off of when we're trying to determine what the severity of the delay is. We're gonna start at a 5-month level. When you have a baby who is delayed 3 to 3 months motorically, then we're gonna base our diagnosis off of that. So would you, I don't know.
Yeah, because we're not gonna expect a kid to achieve feeding milestones when their motor milestones are not at that level. So the way I like to explain it to parents is, if I have a baby that's coming in at a year old and they're not walking, they're not crawling, maybe they're just sitting up. And how old is a baby who's just sitting up? About 6 months old, right? So I'm not gonna be expecting this baby who's a year to be eating like a 1-year-old. I'm gonna be looking at them like a 6-month-old, because that's where their motor development is. Your feeding development is never going to surpass their motor skills.
Absolutely.
So they have to achieve certain things in their motor development to achieve those things in their feeding development.
Right. So if you look at the gross motor skills, typically they develop, you roll first, then you start sitting up, and then you kind of start moving into quadruped, which is on your hands and knees, and then crawling, pulling a stand, walking. So typically when we start introducing solid foods to kids, it's around 6-ish months. At that age, like Julianne said, they're starting to sit up. So if a baby's not sitting up, then you shouldn't be expected to have them taking purees quite yet. It really all stems on those core muscles. You have to have that good core stability in order to make sure the swallowing and everything flows through the body like it's supposed to.
Yeah, and we look at that based off of neurotypical kiddos. So kiddos born at their typical gestation age, and we base all that development off of that. So, you know, when, like we were talking about, you know, a kiddo, I don't know what age they start crossing the midline. So which age do they start doing that?
With crawling, right? With crawling, they would start doing more rotary movement and then better.
It's sitting too, they can cross the midline.
Yeah.
And rolling, because you have to kind of move your arm across your body in order to roll over. So probably 3 or 4-ish months, they're pretty good at crossing midline.
And we've had a lot of kiddos before where we're treating them for feeding, and we have this kid that all they're doing is holding the bolus at midline and mashing with their tongue. And we've been working and working and working, and we cannot get them to manipulate the food. And so I'll talk to Ashley and I'm like, well, how are they doing crossing midline and other tasks? So if a kid's sitting up independently, but they're not able to reach past midline to, grab an object or do something like that, well, that plays into their ability to move their tongue.
They're not going to be able to lateralize their tongue from side to side.
That's actually something that we implemented in one of my kids, where you were saying he was having trouble lateralizing. See if during speech we can get him to cross midline to reach for toys and
Yep,
stuff.
so we just incorporated some activities into their speech therapy, putting puzzle pieces to the side and having them reach for them rather than right in front of them to kind of bridge into those things that we were looking at for feeding development. So you see that throughout development, okay? So they get better head control and they're sitting. So that's, you know, about when we're implementing, you know, some spoon feeding. And then they're doing better with crawling. So then you're gonna get better chewing and more rotary movement for chewing. So we see this as kids get older and their motor development progresses, and so does their oral motor development. So that's why there's between 4 to 6 months you do this, because it's not really at 4 months you should be introducing this. It's where are they with their motor development. And that's one thing, you know, we're not huge fans of Gerber food, but one thing that Gerber is doing is on their packages they have for crawlers, for sitters, for walkers, and that's wonderful because they're pairing what they're supposed to be able to do motorically with the type of foods they're presenting for their oral motor development. So
and then that, like the rotary chew, like we talk with Ashley a lot about how they're doing in other areas motor wise too, because you know, if we have a kiddo that's, what's their walking pattern like? What's their crawling pattern like? I mean, they're discoordinated with that, and then we're trying to establish a good rotary chew so that they can eat chicken nuggets. It doesn't matter what the age is, it matters what their motor age is. So going back to our baby today, so you know, we did the assessment, a very weak suck, inconsistent suck, not really, very minimal.
wasn't really latching,
No,
very
no.
weak,
Very-
really weak jaw strength.
And so we were, you know, when we were basing our diagnosis and our severity and recommendations, we went back to that 3-month period. So we're saying motor skills are at 3 months and he's functioning comparable to a couple-week-old baby. So the severity for that would still be a moderate delay. He's still functioning, you know, 3 months behind where we would expect him to be. So recommendation for that was 1 time a week for the next 3 months, and we're going to start working on, you know, also very hyperaversive.
Yeah.
So
Yeah, decreasing aversion, yeah, working on getting that suck. But what's that saying? Like, I've heard people that saying you eat and talk like you walk, and that really
Jennifer
goes.
Myers,
Yeah,
she
that
always
goes
says that.
with, you know, how your body is and your stability. I always say this with parents: if a kid isn't really stable with their sitting, they're going to be more focused on what's going on here than controlling what's in their mouth. So they're not. This isn't safe if this isn't stable. So it's really important to stabilize this. So with parents who have kids who are really significantly delayed, maybe have CP, that's never to say your kids won't achieve certain things if they can't do these things. We as therapists can implement compensatory strategies and other modifications so that they can meet their maximal potential as far as feeding in a safe, effective manner. But when we're looking at these kiddos, we really need to be looking at where are they in their motor development in comparison to their feeding development and those milestones, and basing our severities and recommendations off of that, and not expecting them to be surpassing their motor development. You could be working with a kid for a really long time and they're not meeting their goals, and so take a look at your motor development, and maybe you're expecting them to do things that they're not really developmentally ready for.
And the importance of collaboration. Why we as speech language pathologists are not the only ones that should be treating feeding patients. We have to treat these kiddos as a team. We need our physical therapist in there. We need our occupational therapist that can, you know, help us. We need to be collaborating with the doctors. We need to be collaborating with dietitians. It's not just us. We can't fix them by ourselves.
So we hope this is really informative. Please send your questions. If you have any more questions about what we talked about today, we can go in a little more, you know, deeper. And thank you so much for watching.
Bye.